So, as is the custom in Australia, I would like to begin by acknowledging the traditional custodians of the land on which I'm joining you today. So, that's the Dja Dja Wurrung people. I would like to pay my respects to their elders, past and present, and to all Aboriginal and Torres Strait Islander peoples joining us from across Australia. I also want to acknowledge that this is an international gathering and each of us is meeting from lands with their own histories, custodians, and communities. Wherever you are, I invite you to take a moment to reflect on the traditional or Indigenous custodians of that land, the place that you're joining from, and the responsibilities that come with being there. As we open a conversation about duty of care in humanitarian action, I think it feels important to recognise that First Nations people have practiced forms of care, stewardship, and collective responsibility for tens of thousands of years. These systems of care were and continue to be grounded in relationship to land, community, and to future generations. So, in this session, focused on equity and the protection of those on the front lines, we would do very well, I think, to remember that justice, safety, and dignity are not abstract principles. They're lived realities shaped by power, history, and whose voices are centred. So I hope our discussion today will be guided by respect and by a commitment to that equity and by a willingness to confront uncomfortable gaps in our own systems. And may we carry forward a real sense of shared responsibility in this space as we really understand and unpack and explore the well-being of all those who serve communities in times of crisis. So, a very warm welcome from wherever you are joining us today. Again, good morning, good day, and good evening. My name is Beth Eggleston from Humanitarian Advisory Group, and I'm very pleased to say I'm joined from some of my other HAG colleagues are on the line, some of our partners from Glow Consultants, and also we have members from the Disasters and Emergencies Committee who have made some of the research that we're chatting today possible. Thank you. I know there are many different sessions as part of this exciting couple of weeks, and thank you for taking the time to be with us. And as we're going to share some really interesting emerging findings from some of the research that we're doing around duty of care. And what we're going to do is share some of that. And then we've got two fabulous panelists, one from India and one from the occupied Palestinian territories, whom I'll introduce shortly. Before we embark on the discussion, we'd like to share a little bit more about the research. So we've got some slides, and I'd like you to know that we have got a survey at the end of these slides. So if you've got your phones handy, there will be a QR code, and we'd really love to learn from you. So the research, as you can see, again, this is a piece of research that's ongoing. So it hasn't been published yet, so it's something we want you to look out for. But we wanted to be able to share some early thinking as we're delving into this area. And again, we'd love to hear from you when it comes to the discussion. So many of you, you've joined this session, and no doubt you already have an interest in how duty of care is operationalized and understanding the differences in the experiences of national and international personnel when it comes to working in humanitarian crises, and really trying to understand how this manifests also when it comes to different donor or intermediary priorities. This research seems to understand this further and to really look at gaps and inconsistencies when it comes to what that operationalization looks like, and really try and understand the difference also from the policies that we may have, but also the actual practice. What are we actually seeing on the ground? And obviously, as part of this research, we don't just want to take a snapshot of what's happening, but we want to try and be able to shape what's going to happen in the future. How can we understand and identify opportunities that might exist to improve what's happening at those front lines? And how can we ensure that duty of care is more equitable in the future? So, as I mentioned, the data collection is ongoing. So we're wanting to drill down into a couple of case studies, so Myanmar and in Gaza. We're wanting to ensure that we can feedback a lot of this thinking and have workshop with DEC members. We're also going to be, so there'll be desk reviews, there'll be interviews, and we're wanting to actually examine a range of different and other humanitarian contexts as well. There'll also be a short survey to capture those perceptions of humanitarian actors. And again, really want to understand that difference between local and international humanitarian workers and the differences in their experiences. So we have, again, these are just emerging pieces, emerging findings and patterns that we wanted to share with you today. And again, we're hoping that you'll be looking out for the research when it's published. So firstly, looking at how the duty of care is currently understood and operationalized. And this may be something that you have experienced yourselves, that it's something that can be very differently understood at different levels, at headquarters, at the field, in different types of organizations. So we're really wanting to look at, and this is very interesting, that really those early indications are that there is broad agreement the duty of care is a core organizational obligation. It's not seen as a peripheral piece. So I think that shows just how important that this research is as we have these conversations. And interestingly, it used to be, I think, something that was, really around risk management and maybe compliance, but actually looking at such an important issue through the framework of equity, inclusion, transparency, and accountability is really important. And understanding really what is the well-being of staff, but all of the different staff that work at humanitarian organizations. So common operational approaches also appear to center on security risk management, and we're again a whole range of areas that I'm sure that many of you have experience on when it comes to staff care, well-being, medical support, and crisis logistics. This can all mean different things in different organizations. And also growing recognition of how we look at support for really good mental health is very important. And early findings suggest that limited attention is given to power dynamics and local leadership. So if we want localization or locally led humanitarian response to be supported and to really be realized, then duty of care is really important. So, persistent disparities between international and local or national staff and partners. I'm sure that is not a surprise to any of you. What we want to do further, though, throughout this research is to really unpack that further, to really look at, what are the kind of mechanisms that can be that are being used and that could be used in the future. We want to unpack further what do policies look like? Is some of this inequity entrenched at the policy level as well as at the operational level? Understanding what the divide really means for local partners. So also looking at local organisations, how they're needing to rely on project-based fundings, which can sometimes undermine and limiting space to build organisational systems. Again, I'm sure none of this is a surprise for you. Some of this may really resonate with you. Some other aspects in this pattern as well, if we go to the next slide, Sarah, again, is like what, in terms of duty of care policies, what exists on paper and what is actually adapted to a local context. This is something, again, I'm sure many of you have experienced that differentiation between those two. I think it's important. I think when we talk about duty of care, it's something that this concept of disparity being normalized, people have got used to these entrenched ways of working. And I think it's really important that we challenge these and we raise awareness of what the disparities actually are and the impact that they have. Local staff receiving weaker protections across training, decision making, welfare compensation, and accountability, despite higher daily exposure. Again, this is one of the frustrations I know that many people have, that there are fewer protections and supports, and yet we know who in the humanitarian staff group are often more at risk. Understanding and unpacking risk transfer practices is going to be really important. Delving more into some of those structural inequalities around employment more generally and understanding what those are is going to be important. And really thinking of duty of care as going beyond just that narrow definition of security. That's something else that we feel is really important. Next slide, please, Sarah. Thank you. So, as I mentioned, we've got some of those scene setting pieces that are coming out through the research, but really wanting to ensure we're looking at what next? What are we going to do with what we find? What may some of the recommendations be, or what some of the opportunities for more equitable duty of care to really be implemented? So, we have some of the early reflections here, and this piece around meaningful change will require structural change. And that's more than incremental adjustments. And I know many of you will have heard the word transformation a lot in the work that you do. So there will be some real thinking in this piece around how do you affect meaningful change? How do we actually ensure that that structural change can occur? So quick wins might include staff wellbeing programs. I think this one is really interesting. We often just think about how do we protect people, but how do we actually invest in people really thriving? So I think the wellbeing programs is really interesting. How to ensure that all the kind of programs that institutions have, though, are accessible, that they're appropriate. Um, Understanding we know that structural change means long-term organizational change, and that will mean having to overcome those challenges of project-based funding cycles and ensuring that good humanitarian donorship needs to have that built into it. Opportunities exist to align and simplify due diligence and risk management requirements. We hear a lot about the burden that some of the compliance has on organisations, but we want to ensure that some of that, the risk management piece is actually going to contribute to better duty of care. And lastly, address unresolved legal and accountability gaps. This obviously is a challenging one as well. How do we look at what stronger enforcement looks like? And how do we ensure that this becomes a default rather than something that is seen as different or unique? And ensuring that in particular local staff are really put at the centre of what duty of care looks like. So these are some of the very high level thinking that we've been doing. We just wanted to give you a quick flavor of this. We have a quick survey here that we would love you to participate in. We can put the link into the chat, but also you can use your phone to hover over the QR code and be able to share some of your thoughts. And we would love to be interacting with you as we move through this data collection phase, but also would love you to be able to interact with the research once that it's going to be launched in May, so not too far away. So stay tuned for that. That'll be on our social media. And we're really grateful to be working with such brilliant local partners to be able to generate this research. And again, our friends at the DEC, it's wonderful to be able to work with colleagues that are tackling these really difficult and sometimes uncomfortable issues, but the realities of the sector that we really want to impact and affect. So that is some quick thinking and some key sort of emerging findings from the research. What we would like to do now is to really have a conversation from some of our colleagues who are working on the front line of this area. And I think it's really important to hear about. There are a lot of different initiatives in this space. I know many of you may have a special interest on this kind of area. So I'd firstly like to introduce to you Nishant. So Nishant Joshi works with Humanitarian Aid International. He works on advancing protection, accountability, and locally led humanitarian action. His work really centres on refugees, internally displaced people, underserved communities, and the duty of care for local and national humanitarian actors who are operating in high-risk contexts. He co-authored the global report on the status of frontline humanitarian workers, drawing on insights from frontline workers across more than 60 countries, catalysing the development of a universal charter of rights for frontline humanitarian and community workers, which I must say HAG has been very pleased to sign on to. He also serves as principal coordinator of the local coalition's humanitarian response roster, strengthening equitable and frontline driven humanitarian response in India. So very pleased to have you with us today, Nishant. I have a couple of questions for you. I'm just checking if Hani has joined yet. I'm not sure if he has, but we might go forward with your questions, Nishant, because I know you have done a lot of thinking in this area, and we're really grateful that you've been able to join us. So, my first question for you, as I mentioned, Hag has been really pleased to learn about your work around this Charter of Rights. Can you introduce us to the Charter of Rights, how it emerged, who shaped it, and the gap that it was designed to address?
Thank you so much for the introduction, Beth, and also thank you for hosting this panel discussion. I'm pleased to be here as well, and I would like to point out that HAG has not only been a signatory and endorser to the Charter of Rights, but instrumental in the development of the Charter of Rights. And previously to that, the report on the status of humanitarian frontline workers. Before I delve into what the Charter of Rights is about, I think a little bit of context is in order. How it came about, what were the necessities, and what were the findings which led to the development, the co-development of the Charter. For the better part of the past 2.5 years, I've been trying to collect evidences on discrepancy and disproportional duty of cares between frontline local and national staff and international staff. This study was called the Status of Frontline Humanitarian Workers, of which Humanitarian Advisory Group had been a major part. We collected evidences from over 60 countries, 700 plus frontline responders participated in it through focus group discussions, survey questionnaires. We had key informant interviews with high level UN and INGO colleagues. And the findings basically reiterated what has been already established, that frontline humanitarian workers face the majority of the brunt, majority of the risks during crises and emergencies, during disasters. But the duty of care that is afforded to them is not in proportion to the kind of risks that they take. Uh, Through this study on the status of frontline humanitarian workers, we found several insightful information, including the first of all uh, disproportionate violence that frontline workers face, the job insecurities, the insecurities when it comes to their medical term or life insurance, their contracts, and of course, there's the psychosocial element, and there's the wage gap element out there. So the Charter of Rights basically is a document that was informed by many many organizations. It was co-developed by Humanitarian Aid International, CWSA, and Protect Humanitarians, but was informed on a continual basis by INSO, GISF, CAFOD, CHS Alliance, and HAG, of course. The basic premise behind this Charter of Rights is to have a sort of a document, a structure that organizations and institutions can adopt into their own organization working to ensure that, first of all, there's right to life, safety, and protection, right to justice, equitable compensation. There's safe grievance response redressal mechanisms without fear of retaliation. There's right to mental health and psychosocial support, protection and accessibility, and right to local leadership and power redistribution. So there are these 6 commitments that are imbibed in the Charter of Rights that is basically designed to address the discrepancies which are being faced by many frontline workers. Right now, we are living in very difficult times. I mean, to say the least, the several protracted crises happening at the same time. Very recently, some major world powers are also embroiled in conflict. And like every other time, it's going to be the local staff that are going to be responding on the front line. I mean, I just read recently that the ICRC has already deployed around 200 uh, response teams on ground in Iran. So yeah, all right. So Evelyn has a question. What I can do is, after I'm finished, I can paste the link to the Charter of Rights in the chat. It's a very succinct and a very small document. So all the 6 commitments, including an additional commitment for digital safety, uh, is going to be included in that document. So that's a little bit about the Charter of Rights. I'd like to go deeper into it, but
Yes.
yeah, I'd like to pass the floor to you for now.
Thank you. Thanks, Nishan. And yes, it would be great if we can pop that in the chat. And we will be taking questions after I get my turn to ask you questions. I would love for you all to be able to, you can either pop some questions in the chat, and we'd be really, really looking forward to hearing from you all. That was such a great background to the Charter, Nishan. And I think something that we've just really loved about your work and how this has been crafted is it's so holistic. Again, it doesn't just have this focus on a narrow definition of security. That being said, we talked about the difference sometimes between policy and practice. So I'd love to hear from you. In your view, how do you think this Charter of Rights can practically support organisations improving duty of care, especially for local and national personnel?
Right. So I think we intentionally designed the charter as a practical implementation tool, and not just a normative statement. So, um, I mean, I'm going out on a limb here, but I would like to assume that most INGOs and NGOs want to improve staff protection, and they want to improve. They want to change the lack of a structured framework that ensures the safety and security of the employees. So what the charter basically outlines as actionable standards are, first of all, mandatory safety audits. So unless and until we have some kind of a procedure in place to be able to assess the level of safety, the protocols that we have, we would not know whether they exist or not in the first place. Protective gear in cases of emergencies. For example, if you are responding to disasters, you have to ensure that your employees, your volunteers, your contracted staff are equipped to be able to protect themselves as well as others. Inclusion of temporary staff in crisis support system. So a lot of the times, contracted staff, consultants might not come under the same purview of safety as your salaried staff do. And yeah, that's something that we would want to change, or at least we are trying to. Hardship allowances, accessible confidential grievance mechanisms, which are basically intermediated by a third party, somebody who is non-aligned with the organization or the people who the grievance must be against. Zero retaliation policies. This is something that you can imbibe into your human resource systems. And guaranteed minimum mental health access. There's something that I also feel that the study that HAG is presenting right now finds a lot of inroads with the study. Uh, yeah.
Yeah, thank you very much. I really agree with you. That piece around well-being and really positive mental health is something that looks to be coming out strongly. So I'm really looking forward to hearing more as we go through the data collection process about the different insights, opportunities, and priorities, especially from local and national humanitarian frontline workers. Um, so I'm sure many of you may have some questions for Nishant. We're going to go to Hani next, and then we will throw the floor open. So Hani, welcome very much. Hani Al Ramwali is the Director of Development and Strategic Partnerships at the Agricultural Development Association, where he drives fundraising, donor engagement, and strategic alliances to support resilient and sustainable development in Palestine. With more than a decade of leadership in program management, resource mobilization, and organizational development, Hani has successfully advanced large scale initiatives in agriculture, food security, and livelihoods in crisis conditions. He's widely recognized for building relationships with UN agencies, international NGOs, and donors, mobilizing resources that translate into tangible impact for communities. His work consistently bridges local needs with global frameworks. And he's really working very much as a trusted partner in delivering innovative, inclusive, and sustainable solutions. So we're really very grateful to have you here, Hani, on this session. Thank you so much. So we're really interested to learn from your experience on the ground, Hani. What are the most significant barriers that local organisations face when trying to operationalise duty of care, both systemically and also in day-to-day practice?
Thank you so much. First, thank you for the introduction. And we really appreciate this event because it's not just to foster the dialogue and open discussion with the frontline responders, but also it's enhancing the localization approach among the world. So thank you so much for organizing such an event. Actually, referring to your question, within our context as a local organization in Palestine, operationalization that the duty of care present a set of its challenging. Actually, these challenging are shaped not only just the broader politically and security environment, but also by structure, financial, and cultural factors that are unique in our context, such as, first of all, we can talk about the limited institutional funding. As you know, that most of local organization relies on the funding, which is typically project-based focus and directed service delivery to the beneficiaries. There is a little flexibility or allocation for staff welfare, health insurance, psychosocial support, or safety training. As a result of that, organizations are forced to divert their limited resources to the urgent staff needs, such as emergency medical care or ad hoc support, instead of long-term duty of care system. Actually, this mitigate the capacity of the organization for protecting their team and investing in prevention measures. Second point, we can talk about the context mismatch in policies and the procedures. As you know, that many of the policies and the procedures that local organizations are required to follow are designing by international partner for a very different context. For instance, security protocol or evacuation plans may assume that the ability to cross border or access certain facility, which is frequently impossible due to the local closure and restrictions. Implementing these externally policy can create additional administrative burden among the staff, and they often do not translated into practical protection or support on the ground. The third barrier related to culture barrier and mental health stigma. There is also a culture it's challenging related to mental health and seeking support. In Palestinian society, discussion of mental health issues or asking for psychosocial support can carry social stigma or leading staff to avoid using resources. This mitigate the effort to providing the meaningful psychosocial support and leave the employees vulnerable to burnout, to trauma, and also long-term long-term stress. The last thing, feeling of inequality and exclusion. Honestly, these systematic and day-to-day barriers combine to leave national staff feeling less valued and less protected than their international counterpart. As local staff may perceive that international employee receive better support, benefits, or security measures, this sense of inequality can negatively affect motivation, well-being, and the sense of affiliation within the organization. So in summary, actually, these barriers are deeply interconnected and making it extremely challenging for the local organization to operationalize duty of care in any sustainable way.
Thank you, Hanny. You've so well explained the different constraints and challenges and how they can be so different in different areas, and that these can be real barriers to how we can implement duty of care in an equitable way. I would love for my second question to ask you, what are some of the approaches or practices that you think have been most effective in strengthening duty of care in a really sustainable and a contextual and culturally appropriate way?
Actually, based on the recent experience, we have learned that the most effective approach to strengthening the duty of care that are tailored to our specific challenging and responsive to the needs of our staff rather than adapting one size fit all model, that we focus on the contextually appropriate and sustainable solution. For example, first of our best practice is that flexible and supportive work arrangement. During the time of a crisis such as escalation in Gaza and West Bank, we immediately introduce remote work policies and allow staff to adapt their work hour or work from home as necessary. This is flexibility only not support staff safety, but also acknowledge their personal and family obligation, which is critical during the emergency. Such as an approach has helped to reduce stress and maintain morale even when the security situation is high and stable. The second best practice is related to prioritizing psychosocial support. Actually, we have made mental health support as a part of the duty of care by partnering with international mental health organization and the professional. Actually, we offer a regular group and individual consulting session, and providing confidential access to support has encouraged staff to seek help more openly, reducing stigma and promoting a healthier work environment. Third one related to continuous safety and security training, recognizing actually in our context ever-present risks in Palestine. We regularly conduct safety drill and providing practical training on how to respond to various security threats, including military escalation, checkpoints, and emergencies. This ongoing preparedness helps staff feel more confident and empowered to protect themselves. The fourth point related to collaboration with local partners. Actually, instead of relying slowly on the international services, also we work closely with local organizations to provide health and psychosocial support. As a local partner are more accessible, culturally sensitive, and able to respond quickly to emerging need, making support more relevant and effectiveness. Lastly, and the most important best practices that we have learned related to staff involvement in policy development and applying the duty of care inside the organization. We actively actually involve our staff in review and developing the duty of care policy. By incorporating their feedback and their experience, we ensure that our policy are realistic, practical, and reflected the daily realities rather than merely replicated the international standard that may not fit with our environment. And to taking an action, and as a practical step, we applying our policy in the designing process phase in all projects by allocating a specific percentage in all of our budget as a duty of care. Actually, these approaches taken together have helped us to foster a culture of care, resilience, and mutual support within our organization. And the staff feels safer, more valued, and better equipped to cope with the ongoing challenging of the working in our context.
Thank you so much, Hani. The practical examples that you shared can really paint a picture of the type of work that has been going ongoing in organizations. And thanks for also mentioning that the fact that the dynamic nature of this, that you can't kind of set up a way of working and that's what things are going to look like, far into the future, but you need to keep revisiting and touching base with staff to understand how it should be adapted on an ongoing basis. So you've talked there about a lot of great practical things that can be done, and what you've been doing within your organization. Can you also share with us what should international partners and donors and organizations be doing and supporting? From a policy level, what would make the biggest difference for you in terms of how you can strengthen duty of care for national and local staff? What would you like to see from that international level?
Honestly, to truly strengthen the duty of care for national and local staff, actually, several key changes are needed at the donor level, institutional partner, and also within our local organization themselves. In our experience, may the following shift would make the most meaningful difference. The first one related to flexibility in the donor funding. Donors should provide more flexible funding that explicitly covers staff care and institutional support, including mental health services, health insurance, and safety training. Currently, strict limits on the administrative cost often prevent the organization of investing adequately in the well-being and safety of the team, even through the local staff or the as a backbone of the humanitarian operation. So the allocated fund for staff welfare would allow the organization to build sustainable system of support. The second one related to context-sensitive engagement for the international partner. International partners need to develop deeper understanding of the unique challenging phase the local organization in working in such a dynamic context like Palestine. This means that involving the local actors in designing, adapting, and review the duty of care policies rather than imposing all the procedures that may impractical or irrelevant. As a real partnership and localization approach can ensure policies are realistic and effective in the local context of the at-risk countries. The third one, this is related to the local organization themselves, promoting the culture of the care within the organization. Local organizations themselves need to proactively foster the culture where staff feel empowered to voice concern and seek support without fears of negative consequences. So this requires strong leadership from the local organization, clear and open challenge of the communication, and confidential mechanism for reporting and requesting the assistance. Lastly, recognizing local staff as an equal part. Actually, there's must a broader shift in the humanitarian sector mindset to recognize the national staff as an equal partner, deserving the same protection, support, and opportunity as their international colleague. Moving beyond the project delivery mentality to one that values and invests in the local staff will lead better retention, high moral, and more effective humanitarian action, especially in high-risk environment like Palestine. Implementing these changes was not only enhance the well-being and safety of the national staff, but also, as we mentioned earlier, strengthening the overall impact sustainability of the humanitarian efforts into challenging context. And addressing them actually require a flexible and dedicated funded for staff welfare, context appropriate policy, efforts to mental health, and commitment to the equity between local and international staff.
Oh, wow. Thank you so much. Honey, these are just such great insights and recommendations. So rich. Thank you so much for sharing that with us. We have a Q&A function on this webinar, so feel free to pop in. We have a great question here that is for you, Nishant, and actually, Hani, I would love to get your thoughts on that as well. Thank you so much, Gareth, for your question, and I'm really pleased and hoping that this piece of research will be useful for you. So Gareth mentions how alarming it is that frontline staff are exposed to disproportionate levels of violence. And he's wondering, Nishant, what you can say about what some of the causes might be of that disproportionate level of violence, and if there's anything that can be done whilst designing new programs. So a fantastic question. Thank you, Gareth. So Nishant, if you want to kick off on your reflections there, and then Hani, I would love to hear from you on that question as well. Thanks.
Right. Thank you so much for the question, Gareth. And without trying to point any fingers at anybody, I think, as Hani had mentioned earlier, that there's a very top-down approach, a very projectized approach to how we work in the aid sector. I would just say that that is likely the primary reason why there's such disproportionate levels of risk absorption between the local and national staff and the international staff. The study that we had conducted last year, it revealed that the local staff are approximately 6 to 4 times more likely to be victims of violence. And let's say about 72 to 80% of field level operations globally happen within 50 kilometers range of the local staff, as they're also belonging to the communities which they serve, their families, their friends live nearby. So naturally, they will be absorbing more risks as compared to the international staff. What was the second part of the question, if you don't mind me asking?
Very good question. I'm just getting it back up again. Maybe I've said that it has been. So it's around, yes, project design. How do we keep this in mind and actually craft programs in a way that can address this challenge directly?
Right. So the Charter of Rights specifically can be used as a policy tool, not just by local level NGOs, but by institutions, by donors. Uh, it basically calls for an equitable pay structure, equal legal protection, inclusion of the local actors in decision-making spaces, which is the most important part of all. Uh, Most of the time, I think because there is such a bottleneck in global institutional funding, especially since the massive USAID cuts and other major donors also retreating worldwide, I think a lot of much smaller ground level organizations fear dismissal if they demand uh, adequate overheads to be able to supplement duty of care for their staff. I think as local organizations, we have to take the initiative to be able to demand that overhead, first of all, and encourage major donors to recognize that uh, local lives also matter and that the risks that frontline humanitarians carry is first of all enormous, and to be able to do our job better, to be able to serve the communities that we are trying to serve, we need to be taken care of properly as well.
That's so well said. I couldn't agree more. And really this concept that it's not a nice to have, it's just good programming. You know, it's the right way to do things. Um, and I'd love to hear from you as well, Hani. I will just a plug for the charter as well. We have the link in there. I really encourage you all, you know, with your organisations to take a look and share that within your organisations and to consider becoming a signatory on that. Hani, I would love to hear your thoughts as well. You know, with such horrific levels of violence against local workers. Yeah, your perspective here is of such interest for us as well.
Actually, I would like to start from the point that shared, sorry, from in the chat from our colleague in Christian A that related to the duty of care already applied, but the local organization that waiting to the end of the project. Here, from the local organization perspective, all of our international partners that providing capacity building to their local partner, for example, about the protection policies, SIA, GBV, etc. Why the international organization didn't provide this kind of building the capacity of the local organization also about the duty of care? Because also it's a policy like another policies that build the capacity of the local NGO about that. So that's why when I mentioned that we need to change our mentality related to the importance of the duty of care, because yes, you are right, the local organization and the budget directly focused on the delivering the activity without knowing exactly the importance of the duty of care for the local staff. So, from my opinion, if we would like to start systematically and changing the structure in the duty of care, we have to start from the build that capacity of our local organization about the duty of care, the component, the importance, and start work with them hand by hand to develop their policy based on the local context. So, starting from building the capacity, work hand on hand to deliver their own policy by the local partners, then how we can, in including these policy and shifting this policy to be a practical step related to the HR and budgeting system and financial system for the organization. So the lack of knowledge related to the local NGO, this is one of the most important reason in this regard. So we have to start build the capacity. We have to start establishing the policy. Then we would going to incorporate these policies into our daily procedures and practices.
Yeah, thank you so much, Hani. Yeah, it really paints a picture of how this is still complex, but how we need to overcome these barriers to ensure the duty of care is really implemented at that practical level. We have another question here. Thank you very much, Rula. A great question around asking questions around the consideration of the legal frameworks here and relevant jurisdictions and local legal considerations. Maybe if we start with you, Nishan, it would be really interesting to understand how you did. I know you looked at so many different humanitarian frameworks, guidance, and benchmarks. In terms of the charter, there is a lot of alignment there. How did you consider sort of other legal frameworks? Perhaps IHL, but I'd be interested from that local level as well.
Right. So the Charter of Rights cannot be set in stone as a mandate. it's a living document. And in fact, if you read the status of frontline humanitarian workers, one of the recommendations was to have a Bill of Rights. And that's why, I mean, a bill would kind of be a forebearer of something legal, something binding. But we did not want it to be binding, which is why we consulted with many, many practitioners, and we settled on a Charter of Rights. Now, this charter is for organizations to adopt themselves and promote, and also inform where they see, contextual challenges, where they see gaps and potentials, so that it keeps evolving and we keep adding contextual frameworks into it. Now, we understand that, you know, humanitarian operations happen across geographies, legal frameworks. There are different political frameworks that are involved as well. So uh, this isn't a universally applicable or a non-negotiable document. Uh, it is sort of, let's say, a guideline for organizations to know what to seek when it comes to effective duty of care, when it comes to uh, mental health, when it comes to safety and protection of their staff, and as an organization policy.
That's so useful, Nishant, because we can see that thinking around decisions that were made to have a charter so that it had maximum flexibility, adaptability, in order for that to be contextualized in a way that's going to be most useful for organizations. So that's really helpful, and that it makes a lot of sense as well. Honey, I'd also be really interested in your thoughts around how legal frameworks, in particular legal considerations, have been considered in your approach, and both. I guess I'd be interested in both how it's enabled the work that you do, but maybe there also were some barriers that it maybe put up for you as well.
Yes, actually, it's one of the most important things to make it under the legal framework. But as I mentioned earlier, for example, in Palestine and the local NGO, that there is no legal framework that related particularly to the duty of care. That's why I told you we can establishing this legally framework inside each of the organization themselves. So when we talk that these kind of policies that developed and approved by the board of director, which will be the legally introduced to other department, then we can start to shifting this legal framework to be in a sustainable way, in a practical way within the legal issues that have at least clear procedures, clear proof of documents, clear clarification how we can incorporate these kind of policies within the legal framework within the organization. So the solution in this regard to start from the organization themselves, to the developing this, approving by the hierarchy for the organization, the board and another committee, then embedded to the practical procedures within the operations and departments in the organization.
Thank you, Hani. Yes, Nishant, would you like to
Yeah,
say?
I would like to also add that we have to respect the law of the land. Uh, the labor codes differ in every country. The the mandates of human rights differ in every country. So the Charter of Rights is not about another layer of compliance to be added. It's about recognizing that sustainability, ethics, and effectiveness of the humanitarian responses in your context depend on how we treat the people who deliver those services.
That's a great point. It makes me also think of the new Declaration on the Protection of Humanitarian Personnel. It's another tool in our toolbox to understand and to use in advocacy efforts. Hani and Nishant, what brilliant, articulate, ideas, experience, perspectives you've brought to our discussion. I really can't thank you enough. That was absolutely brilliant. I would like to thank everyone for joining us. I'll just see if we can pop up our cheeky QR code again, just in case some of you may have missed the opportunity to respond to our survey, because we would love to hear from you. And if not the survey, do feel free to reach out from us to us about the research. Look out for it being published in May. We'll put bits and pieces on our LinkedIn. But we've just so thrilled that so many of you chose to join and hear about this really important issue that I think we all feel very passionate about. And we hope that this research, together with the DEC Insights and Glow Consulting, that we'll be able to provide some real insights and hopefully useful practical recommendations that can really shift the dial on this really, really important issue. So I hope the rest of the next couple of weeks and all your networking and events goes really well. Thanks so much again for joining us. And I hope you have a fantastic rest of your day or evening or morning. So thank you very much. See you later.
Thank you so much, Beth. Thank you, everybody.